Hello and welcome to Upfront. My name is Dean Thullner-Veljacic and we are filming on the unceded Nanaimo traditional territory. 1 year ago, some of you might recall, I had Donna Hais, who is the chair for the advocacy group Fair Care Alliance. I've invited Donna back in this show to get us up to speed. That's all about Nanaimo Regional General Hospital and what's going on with Fair Care Alliance. Thank you, Donna. Welcome to the show again.
Thanks, Dean. I really appreciate you having me back.
Of course. Well, we're super excited to catch up and to see what's happened over the past year.
It's been busy.
Busy, yeah. Can you remind the audience, or maybe let the audience that didn't catch the show last year, what is Fair Care Alliance?
So the Fair Care Alliance is an advocacy group who speaks on behalf of the population that lives above the Malahat regarding access to fair and equitable health care.
Mm-hmm. Well, everyone's talking about healthcare, right?
It is, top of mind.
Lineups and people being frustrated they can't get doctors. So what is the mission of Fair Care Alliance?
So our mission is to ensure that everyone living north of the Malahat has fair and equitable access to tertiary level care. And you know what, Dean, I'm going to expand on that. Our work this past year has clearly shown that our vision is providing everyone, the nearly 1 million people that live on Vancouver Island, fair and equitable access to tertiary care, no matter where you live on Vancouver Island.
So what is the catchment or the communities that access Nanaimo Regional General Hospital?
There's a little over 470,000 people in our catchment area, so that's everything north of the Malahat.
Right. And this hospital was built when?
1962.
And with the population increase, clearly we are not meeting the needs of the population.
That's correct.
Okay. So what is your vision? What's the long-term goal here?
So the long-term goal is to build out Nanaimo Regional General Hospital till its full potential. It's listed currently as a tertiary hospital center, but to build that fully out to its full capacity as a tertiary center for Central Vancouver Island. And
Vancouver Island, of course, was generally always known as sort of a retirement community and aging population, but that's not true. I mean, they're saying that Nanaimo is the fastest growing city in Canada and the population is expanding in all demographics. Can you elaborate on that?
So we're in this weird dichotomy. You are right, we're the 5th fastest growing center in Canada. Lots of people are moving here of all ages. However, we are also the oldest population in Canada. So as you can well imagine, our healthcare needs are greater here in Central and North Vancouver Island than they are in other parts of the province.
Mm-hmm. Okay, well, we're going to get to what our needs are and what we're lacking, but I think it's important that we should celebrate some of the great achievements that have happened this year.
That's
right?
true.
Okay.
Yeah.
So we have a lot to celebrate. We have the HAU High Acuity Unit. Why don't you introduce that to the audience? What does that mean for the community?
So that's a really exciting development that just opened the last couple of months at Nanaimo Regional General Hospital. That is 12 high acuity beds. So ICU was opened the year before. That was 12 beds. That was replacement of the existing 9 beds plus an addition of 3. But we never really had a high acuity unit, which is the level right below ICU. We now have 12 HAU beds. So in total, 24 high acuity beds, ICU beds that allow us to treat the most sick patients that come in. So that's very exciting. And it's part of what has desperately been needed at Nanaimo Regional General Hospital.
Yeah, we've all heard stories of people going to the hospital and they're sort of in the hallway or in the chapel because there hasn't been enough beds. So clearly this expansion is taking not only the heat off of the emergency, but it's allowing better respite or better care for the people in other areas of the hospital.
That's true.
Yeah, that's great. Let's go back to the ICU opening with 12 beds, again taking the heat off of the general area. Yeah. But how's that going? What's the accomplishment of that?
Well, that's great. We had some of the worst infrastructure in Canada in our ICU. We had only 9 beds servicing the over 470,000 people. If you can imagine, that ratio is just really unthinkable. And so, the province and the regional hospital board, they all invested in not only giving us brand new state-of-the-art infrastructure, but upping that number from 9 to 12 beds. And so that is a huge jump for us in terms of available beds for things like COVID patients during a pandemic, or those that are critically sick who have had, strokes and heart attacks, and we actually have beds now to be able to service those patients.
But we're also servicing the people that service these patients by providing better areas for them to work, better equipment. Yes. We're going to talk about the staff and all the great things that are happening at NRGH and why we're attracting new doctors. But to be clear, these actions not only service the community and better healthcare, but they help us attract better community workers to be enticed to move to our community to boost our healthcare. What is that looking like these days?
So I don't think it's a far stretch for people to understand that healthcare and economy are directly tied to each other in a direct link. Mm-hmm. And to be able to draw the staff that we actually need to service our population, we actually have to have the infrastructure in place to be able to do that. Mm-hmm. We have to create that atmosphere like we all want in our workplace, a healthy workplace where we have what we need. We have access to the infrastructure and the new technology at our fingertips, and we desperately need those things in healthcare. So being able to provide that brand new infrastructure gives us something to then attract those medical professionals to our area and give them that working environment that they need.
Well, let's be honest, no one's signing up to work in an environment that could actually put their reputation at risk as well.
That's right.
Everyone wants success at their workplace.
Exactly.
Yeah, that's great. So I was at the hospital a few weeks ago. I was running around. In fact, I was doing this campaign, which I'm going to talk about in a second, parked outside the hospital. I saw this giant hole outside the front entrance. What's that about? What are we building?
Well, that's something we all need to get on board with and get excited about. So groundbreaking happened last week. That's the new cancer center that's coming to Nanaimo Regional General Hospital. Yeah, a lot of different groups working really, really hard together to create this opportunity for Nanaimo and Central North Vancouver Island. And what it means is that our patients aren't going to have to go to Victoria to get cancer treatment. They're going to be able to get it in Nanaimo. They're going to be able to get radiation. They can already get some chemotherapy, but that's going to be expanded. The exciting news is that we're getting a PET scan in Nanaimo.
What is a PET scan?
So that's a very specific type of technology that is used in radiation and in treatment of cancer. Not always given to cancer centers. We know there's a new cancer center also starting in Kamloops, and they're being given an MRI. But the province worked hard and got a PET scan for our cancer center in Nanaimo. That is a huge reason to be excited and is a great advantage for patients on Vancouver Island. Mm-hmm.
Well, sure, there's also a long wait too, right? We need to expand that. I'm personally waiting for an MRI for a disc situation in my hand. It'll probably be a good 6 months to a year, right? Yeah. Well, that's okay. There's lots worse than me. So I also hear a buzz about a long-term care facility that's coming to Lantzville. What is that?
So that's been an announcement by our provincial government. I don't really have any updates on when we're going to break ground and when that's going to get started. The sign is up. We're excited about that. But why is that important?
Yeah, why is that important?
Our hospital capacity is 354 beds. We are well over 400 beds every single day. So that has not changed in the last year since we last spoke. As a matter of fact, it's gotten worse. And so when you go into our emergency room, there are people in corridors, there are people in closets, there are people in the sanctuary, there are patients everywhere. And they are critical patients. As I mentioned, oldest population in Canada. These are patients who need access to rooms. There are multiple people, over 10 people share a bathroom in the facility. But a lot of those patients could be transferred to a long-term care facility and don't necessarily need to be in our hospital. So if the long-term care facility is built as projected in the near future, we're going to be able to transfer those patients and free up some of those services while we wait for the tower to actually be constructed. So it is the long-term care beds is part of a comprehensive plan around the Nanaimo Regional General Hospital and how we're going to effectively use the infrastructure we have.
Well, the other thing is like these new hospitals, like I'm going to refer to the new St. Paul's Hospital, right? It's being built in Vancouver. It's a massive footprint. And the reason why it's so massive, my understanding, is that the new plan for healthcare is that everyone should have their own space, have their own bathroom, so that we're not only not able to service people with multiple people in one room, but we're also not spreading diseases, or we're not having to worry about people arriving in the hospital and leaving with more complications leaving, right?
Infection control. control, right?
Yes, of course. So this will provide, my take on all of the things that we're celebrating here is with the new HAU, we've got the ICU, the cancer centers coming on, the long-term facility. We're going to be able to spread all this out, and we're going to be able to allow the people that are in the hospital to have better health care and safer health care.
That's correct. Doesn't mean we don't need the infrastructure we're going to talk about in a few minutes. It just means we're on the road to getting what we actually need to be able to provide that fair and equitable health care to everyone.
So how are we going to get that?
Well, it's still going to take the care, the voice and the ambition of our population speaking to government to hold their feet to the fire. Right? We thought fair care, our mission was done when our premier announced, as he did during the election, or he promised, rather than announced, he promised that Nanaimo would be getting a new patient tower, which we also expect will come with the tertiary services that we so desperately need. It will come with a cath lab and cardiac services. It will come with neurology. It will come with the services we're going to talk about. And that was promised. But you didn't see it in the budget in March, and we're still waiting. And that's a part of our current campaign that people will see online. We're still waiting.
So I was part of that still waiting. Let's take a moment here and play that video.
We're still waiting.
We are still waiting.
We are still waiting.
We are still waiting.
We're still waiting.
We are still waiting.
We're still waiting.
We are still waiting.
We are still waiting.
We're still waiting.
We're still waiting.
We're still waiting.
All right, so that video has a lot of people that are standing up and still waiting. Who are the people in the video? Who came forward to support that?
Those are people from community. Those are patients. Those are patients' families. Those are people who are on wait lists, like yourself. Those are people who need access here. Those are everyday people in our community who are saying, this was promised, it's not here, and we're still waiting. We want our government to know that we have not gone away. A promise does not fill the need. We need action to fill the need, and we are still waiting.
Yeah, and you are active in the community. Recently you had a town hall at Nanoose Bay. How many people showed up?
About 400 people.
400 people.
Yeah.
So will there be more town halls, more action coming in the future?
I think you will see more events coming to communities. There are lots of events that we've been asked to speak at. We're already booking events into 2026. And so you will see more events coming and more of our campaign, more media campaign coming forward as we move forward.
So if I'm watching the show today and I want to be part of this, I want to learn, I would go to the website.
Go to the website.
So if you're watching the show and you want to get up to speed, or you want to hear, you want to voice, you want to be able to people to listen to your plight, definitely go on the website and make sure you follow what's happening. They're there to support you. Okay, so the bad news is that we've got a tremendous list of things that we do not have at NRGH. And I'm going to take a moment here to read this list because I want people to understand the necessities that we don't have and the impact of the healthcare that we're not getting and why this is a dangerous situation. Okay, so at this time we are not short, but we need support in vascular surgery, oncology, infectious disease, hematology, palliative care, endocrine pediatric, neurology, general pediatrics, geriatrics, wound care, vascular surgery, interventional radiology, stroke care, trauma, pediatric psychology, critical care HAU, general internal medicine, cardiology, and gastroenterology. This is a staggering list of areas that our hospital is not being able to facilitate to our community. If you fall under these categories, where are you sent?
You're sent to Victoria.
And Victoria, I'm sure, is busting at the seams and is not capable to service two communities at once.
Well, and I think that goes back to my comment about Fair Care has really realized that we've expanded our mission and vision to include all the people on Vancouver Island. You are completely and totally right if you're presuming that patients from Central and North Island are clogging up the system in South Island. There are 2 tertiary hospitals in South Island. Nanaimo is the designated tertiary center for Central and North Island. It is not a community hospital, it is a tertiary hospital, of which there are 19 programs, you just listed them, that are supposed to be in our center. The one thing you didn't list is nephrology, because that's the one program, kidney care, that we have in Nanaimo. But kidney patients are complex patients that need cardiologists and neurologists and other types of specialists that you listed there. But we have to send those patients down to Victoria, or in some cases over to Vancouver, to get the care that they need, which means we're separating them from their families, we're isolating them and making their care further away from home. We need to bring that care home, back to our community, so those people can be with their families and that support network that works behind them and holds them up. So I think it's really important to acknowledge that, the stories that we're hearing about people dying that don't need to die are happening because that level of care is not in our community. And that's what Fair Care is fighting for.
Well, it's also not, Victoria on a beautiful August day is accessible. In November, to go and have to spend time with someone who's in that hospital, that can be economically a struggle, that can be physically difficult for people to get there. It's not convenient to be spreading this out. Are you relying on up north at Courtney Hospital as well?
So Courtney and Campbell River and the new Cowichan hospitals that's coming, those are really exciting hospitals. They are community, so is West Coast General. Those are community hospitals. So I break an arm, I need an appendix out, I'm going there all day long. Nanaimo is the community hospital for those that live in the regional district of Nanaimo. That's where we're getting our community care. But if you have a heart attack, you are being transferred from those hospitals to Nanaimo. And we do not have a cath lab here.
Yeah, I wanted to talk about that because that was very frightening. A lot of people reached out to me after the show. It really motivated a lot of people to go to these rallies because I think heart attack and stroke is the #1 killer in Canada.
It
yes?
is, yeah.
So let's talk about the cath lab and the impact of not having a cath lab in Nanaimo.
So right now, you will hear Fair Care speaking more about a cath lab than the other specialties that you listed. And the reason is because we feel that service or that infrastructure would create the greatest impact for those living north of the Malahat. As you said, heart and stroke is the #1 killer of Canadians. That statistic is no different on Vancouver Island than it is in the rest of Canada. The access time for someone having a heart attack is 90 minutes to a cath lab. That is not possible by the time you get shipped to Nanaimo and our physicians, examine you and then call down to Victoria to see if there's a bed down there for you and then transition you to Victoria. So right now, all we can give is a clot busting drug called a thrombolytic, and the side effects of a thrombolytic, which is a blood thinner, a lot of side effects are stroke. Also not great outcomes. The other thing we like to talk about is that time is muscle. Right? So I think on Vancouver Island, one thing we need to talk about is what does quality of life look like when you have delayed access to healthcare? What are those outcomes? Well, the longer you get a delay in being treated for your heart attack, the more muscle that dies that you don't get back, the less success you're going to have in future with your health, the more medication you're going to be on, the less active you're going to be. And I think we need to have this conversation.
And your recovery is going to be
And your
arduous.
recovery is harder,
Yes,
right?
yeah.
So to be quite frank, you're going to cost the healthcare system more money later on, getting worse access to healthcare. And so right now, that's why Fair Care has focused a lot of its conversation around the cath lab. That's why at our town hall meeting, you heard our doctors stand up and passionately talk about what's happening, about patients who are dying from lack of access or who are having worse outcomes because of lack of access. And so that's what we've been focusing on. We believe it would have the greatest impact to have a cath lab built on the site at Nanaimo Regional General Hospital.
Well, of course, because as we've already discussed in this interview, we are an aging population, right? Yeah. Heart and stroke, heart attacks, it's a #1 killer. So I would encourage the audience again to go to the website, go to the rallies and let them hear your voice. You as members of our community deserve to have health care. You deserve to have access to life-saving solutions for you. So, we can all sit around, we can talk about it, but it does take action. And I am here to tell you that I've seen this 1,000 times. One person can make a huge difference. A community can make a greater difference. So you need to reach out to your politicians, you need to reach out to your mayors, you need to reach out to community, make a voice, and make sure that you're heard. Because this has to change. This is not sustainable. This is not adequate health care. Okay, so I want to talk about, you had mentioned that you wanted to talk about the nurses and the doctors.
I do.
Well, let's do that. It's cheerier.
I do.
Okay, let's talk
Well,
about
I mean, maybe it starts off a little less cheerier than I would like. I think the thing the longer we're in this conversation, the more I realize two really important things. Is that the infrastructure or the facilities that we've given to our healthcare professionals is inadequate. It's not really fair to ask a surgeon, a nurse, a technician to come and work with subpar infrastructure, subpar technology that goes outside of what their training is. In medical school, when you're training to be a cardiologist, they don't even train on what a thrombolytic is. So you're asking those physicians and those staff members and those nurses to come and work in subpar conditions. So the mental health piece for those people is hugely strained when you know you cannot give your patient top-of-the-line services. And you know that your hands may be tied in providing, life-saving procedures. So I think all of us that are going to our hospital, all of us that are going to our doctor's offices, I think we need to go there with a little bit of grace and realize what we're asking of those healthcare professionals in our community and have a huge amount of respect for what they are doing. Because on the flip side of that, what I'm saying and to tell people today is our teams, our medical teams, our nurses, our techs, our doctors, they're overperforming. Survival rates, what they're doing are creating miracle opportunities in our hospital. I have been a parent in the peds ward for a child that I did not think was going to survive. And I have to tell you, when I left, I sent flowers to the staff. It's the staff that are pulling us through this huge deficit in infrastructure. And it is critical for all of us to recognize that they are constrained and they are suffering in their workplace, but they're not showing that to patients. Instead, they are being innovative and creative and providing top-notch healthcare to us as patients that are going into those facilities. And I would just plead to the people that are hearing what Fair Care is saying is please treat those people with some respect and some grace and thankfulness, because they are really doing an exceptional job.
I would agree, and I can say here, you know me well enough, I've got my fingers in a lot of different areas in Nanaimo, I'm pretty active, anyway, I digress, but I have spoken to a tremendous amount of individuals that have gone through NRGH, and despite the minor complaints of, lack of space or the wait times, I honestly can say that I have never heard a negative comment about the staff that works there and how incredible these people are and how they're giving 200%. They're exhausted, they're working under situations that may not be ideal, but the respect that these people get and the care that they get, I hear it time and time again how fantastic the staff is at NRGH.
Yeah, they truly are.
It is, it's great. Yeah. So this isn't just a call to action for us to get better healthcare, better services, and better equipment. This is a call to action to support those people that work within the halls of the hospital. Yes.
It is. Mm-hmm. It is. And for those who don't think your voice matters, I would point out that the only reason that we received a promise of a new hospital tower with these services during our election a year ago is because we spoke as a community with one voice about what was important to us.
Mm-hmm. I've been to the town halls. They're powerful.
They are.
The one at Bevan, it was packed. Yeah. Well, I always ask Donna, if you could speak to the community right now, all the viewers that are watching this, what do you want to say to them? What do you want to ask of them?
I want to ask them to continue to support the work that Fair Care is doing. I want to ask of them to provide that positive, empowered voice that holds up our healthcare workers and respects them and applauds them and shows the need to our government to get involved and do the right thing.
Yeah, because we deserve better. The healthcare workers deserve better. We as a community deserve to have ultimate healthcare.
Well, I feel that we at least deserve access to equitable and fair healthcare that is the standard that all Canadians receive.
I agree.
And we don't receive it here, and it's time that changes.
Okay, so if you are watching and you want to help, hopefully you want to help, you can go to the website, which is weneedhealthcare.ca. You can sign the petitions that are there. You can show up to the rallies. Follow them on social media. So Instagram is at Fair Healthcare Now, and Facebook is at Fair Healthcare Now. Talk to your neighbors. Talk to your friends, make this an important conversation in your house, and let's try to make a difference and support not only the medical teams, the nurses, the doctors that are there for us on a daily basis, but let's support Fair Care. Let's support Donna and what they're trying to accomplish so that we all have a better quality of health care. Anything else you'd like to share?
I just want to say thank you, Dean, and thank you for the work you're doing in community. As you mentioned, you're busy.
Yes.
I'm busy, but I've seen some of the pieces you're bringing forward, and we need leaders in our community to stand up and support. You know, the model that we have right now is broken for healthcare. I think we all know that. I think we need to acknowledge that and look for new ways to move forward. And we do that through creative, strategic partnerships and getting outside of our boxes and taking a stand on the issues that are really important. And I've seen you do that, so thank you for doing that.
Well, I've got a big surprise coming in the new year for sure to help at-risk youth. But I can say honestly, like, fundraising is crucial for the NRGH Foundation, right?
It is.
Or for Fair Care. And, you know, no event is too big or too small. I always say, you know, whether you do a bake sale or you want to organize a small fundraiser or whether you want to produce a gala, reach out. Everyone, they need your support. And there's nothing too big or too small.
Correct.
Great.
Thank you.
Well, listen, once again, thank you so much for joining me. I'm happy to be able to provide this platform to get everybody caught up to speed for what's happening at NRGH and for Fair Care Alliance. I wish you guys all the greatest success. Keep making noise. You know, we're going to support you as best we can. Thank you so much for joining me on Upfront, and I look forward to seeing you next time.